Good morning, and thank you for coming here today. I want to start off by introducing myself. My name is Parichat Stout. I'm a licensed marriage and family therapist and clinical coordinator for the Therapeutic School-Based Mental Health Program. I have a little bit of a sore throat, so if you don't hear me, just raise your hand and let me know, and I'll try to talk louder. So a couple of things. So in today's presentation, you're going to learn about the Therapeutic School-Based Mental Health Program and its services, and if you're interested, how to get your students started in the program. So I talked to some of you already, and so I know that you have kids who are attending the school. But if you could please raise your hand if you know or are familiar with what outpatient services are or have participated. Okay, so kind of. All right, that's great. That's great. So I wanted to start off by giving you a little information about what the Therapeutic School-Based Mental Health Program is. Sometimes it's referred to as school-based mental health program or school-based outpatient services, but basically it's an outpatient service that's provided at our therapeutic schools, which is the North Hills Prep School and Park Hill School, which are both conveniently located on this campus. So the Help Group's outpatient department is called the Child and Family Center, which they have a continuum of mental health services ranging from medication support services, counseling services provided by their therapists, case management services, and all these other wonderful programs. So the idea of the Therapeutic School-Based Mental Health Program was to provide outpatient services here within the schools to our students who are in need of additional counseling services or need to receive medication services or have a case manager on their case supporting them. The program works typically with the student, but also requires a lot of involvement and activity with all the family members as well to make sure that the students' goals and treatment needs are addressed. So now let's talk about the services. I want to kind of walk you through about the different services that chronologically that a family would be receiving. We start off with a clinical assessment. Now this is a real important part because it allows us to really get to know the student and their history, their mental health history, their strengths, and what their expectations are in the treatment. And from there, the therapist is able to identify the resources and referrals that we would need to help execute and make those objectives come true. So some of the referrals are, like what I said, to refer to have medication management services, to explore case management needs, or in some cases we may find out that a higher level of care services is needed, so we provide linkage to our other help group programs that provide more intensive services. The other crucial part is treatment planning, is where we come together with the student and the family and the therapist and really work out what are some specific core goals that we want to work on in treatment. And from there we also identify the individual therapy, the counseling regimen. Are we going to meet for individual therapy and family sessions once a week? And how do we incorporate the parents in getting their parent support or parent education so that they can find better ways to support their child with interventions and understanding the student's needs. There will be a lot of consultations involved as well. The school-based therapist would like to know if there's any other services or providers that are working with the students, such as the regional center or any other service, so that we can all work together as a team. So the role of the school-based mental health therapist is pretty much the student's therapist. But in addition to that, they are also like the point person for the parents and the students here on this campus. The school-based mental health therapist will work to provide linkage and make sure that all the treatment providers, such as the psychiatrist and case manager, are well informed or up to date on the client's progress. They'll come together for consultation sessions to make sure that everyone gives their input to create a specific plan to really help the student move forward in their treatment progress. This also applies to working with the school teachers and school counselors and consulting with them to make sure that we know what the school's goals are, and to kind of work together as a big team to really push the student forward in achieving goals, or brainstorming of what works and what not, to make this all come together nicely. Now, a lot of parents ask, what's the difference between a school counselor and a school-based mental health therapist? Which is really a good question. The school counselors work primarily with focusing on the students to achieve in their academic world, while the school-based mental health therapist, we kind of look at the students from a bigger picture, their school functioning here, their social functioning outside of the school, their aspirations and dreams of what they want to be down the line after they graduate school, and also the family relationship. So we look at their, we support them from a larger picture. I think it went backwards. Okay. Now, in terms of eligibility, like how do we get started in the services? So the first and foremost, the most important thing is that the student has to be participating in one of our therapeutic schools. The other component is that the student needs to have full scope Medi-Cal. And in order to get the process starting, if you feel that you would like your child to receive services in the program, is to speak to the student's school counselor so that they are aware, and then they'll start by completing a referral and then contacting me. You're also welcome to reach me directly with the information provided if you have questions, or if you want to explore whether this program is a good fit for your child. So in closing, I wanted to leave you with a little note which kind of takes us back a little bit. Prior to me becoming a therapist, I was an information and public relations officer for the Tourism Authority of Thailand. So I help journalists and potential travelers, individuals and families help plan and give them information and resources on traveling to Thailand, and help creating their wonderful, tranquil and adventurous trip. At the same time, I also provided resources and information on safety and travel in Thailand. So while coming to school here is not like a vacation or a trip to Thailand, but it is also similar in a way that I think families want to have a peace of mind and know who their point person is. They want to know who is up to date and really involved with the student in developing and working with them on their treatment plan, really connecting with the teachers and coordinating and problem solving current situations, or helping the students strengthen their skills through special school programs or activities. So the key message that I want to leave here is to really communicate and make that connection with the school counselor, or if the student has services within the school-based mental health program, the school-based therapist themselves will be that point person for you and help you problem solve, be a resource to referrals, and to work collaboratively with you to make sure that the student's treatment goals are met. So that's my brief presentation, and I just wanted to thank you again for coming. And if you have any questions, we'll spend some time talking after this. But thank you for your time.